Ladies and gentlemen, good morning. Having listened to several of this morning's sessions, we've been learning about some of the challenges, but the amazing and exciting opportunities in the African continent. Of course, fundamental to every human being is the desire to stay healthy, productive, and a key part of that is not only individual choices, but the health system. And I'm delighted to be joined today by some amazing leaders who come from a very diverse background, all relevant to healthcare technology, practice, media, communications, investments. And interestingly, and I'm delighted to have Yvette with us because there's so much to be learned from other systems such as development of clean water access. And may I remind our audience that some of the first public health initiatives in the world started around water cleanliness and, of course, waterborne diseases. So without further ado, let me just set one sentence as a context. If we could scale up digital healthcare across the African continent, some of the most conservative estimates suggest that 400 million humans would have access to healthcare better than they have today. And if you could then scale that and democratize it into remote parts of Africa, it would be 700 million. That's 70% or so of the continent that would be having access to healthcare. Not only does that increase health, but has a major contribution to GDP. So I'm going to ask my friend, who's usually on the other side of this discussion, as the moderator, the first question here, and this is open to, of course, followed by any of our attendees. Mehmet, what are the new forms of medical delivery systems that, in your opinion, could revolutionize healthcare, in particular, thinking about Africa?
Mahmoud, I believe much of what you're doing, actually, in evolution will be massively important. And the reason is because so much of what we're doing to look at longevity and what it can offer is going to be aided, but also support the development of artificial intelligence. And AI, I believe, will be something that rapidly scales in Africa. We'll do the development expense in the West and in the East. But the actual deployment in Africa will allow us to take technologies that are limited right now and allow them to prosper. And I'll give you a couple examples. Because when you think about remote patient monitoring or telemedicine, these are tools that will only scale quickly if you have AI behind them. But there's two technologies that I was looking into anyway, and I did a little homework in preparation for this session. The first one is a company called Orbis, interestingly, that can go out and with very little professionals on the ground, look in the eye, and because you can see the brain in the back of the eye, make a lot of diagnoses, not just about topical issues like cataracts, but also what's going on in the retina and what other diseases can you diagnose because of it. The other is a company that is a digital stethoscope called Echo, but you can put this device on the chest of a person and diagnose heart failure. In fact, the recent paper that they put out shows maternal risk issues being diagnosed, like cardiomyopathy, where the heart of a pregnant woman dilates under the stress of the pregnancy, and that could lead to demise. Well, getting every woman screened in Africa by themselves for this is hard, but this device you can put on their chest and fairly rapidly identify it. So we can take the investment that we're making in the West and use it in Africa. And this is not altruistic, because we're all in this together, and by doing it well in Africa, you'll also be able to do it in parts of the world that maybe get left behind and that are underserved as well.
So let me, Professor Shafi, you recently gave a keynote around data, AI, and Mehmet just raises two different important components. One is how do you invest in this space, and I'll come back and ask Jeffrey to, but as a physician scientist and now thinking about data and AI and these systems, what's your thoughts around, to build on Mehmet, where do we go from here to accelerate the pace of implementation?
So I'm going to reverse the question in a way. Technologies, we're very lucky in 2024. We have the most amount of technology we've ever had in human existence. And we can name many of those. But actually, the fundamental part is not the technology, it's what problem are you trying to solve with these technologies. Africa has 4 problems, similar to the rest of the world. There is a global workforce shortage. We know that. The WHO mentioned already in the report that the world will be 15 million to 20 million health workers short by 2030, if not more. So that's a problem. Secondly, of course, it's the space in Africa, so sparse across the continent. Therefore, connectivity will be important. Thirdly, the scarcity of resources and paucity of infrastructure. So there are 4 elements that need to be solved. So the question now for me is, how does technology overcome some of that burden? Take the first one, the workforce shortage. I think AI certainly will be an additional bonus for people to assist, to support, to augment clinical practice. For doctors, for nurses, for healthcare workers. We use the same amount of people in a smarter fashion. Smarter working patterns, using AI assistance is the future. And large language models, when they came in November 2022, changed the framework of our society forever. The genie is truly out of the bottle. The second one is about the distances people have in Africa. So therefore, connectivity, being hyper-connected, Starlink, 5G, 6G, 7G, 10G, coming, connecting people across a continent. Essential, because if you look at Africa, the mobile phones came a long time ago. Mobile money actually came into Kenya in 2007. Way before the West ever thought about it as an alternative was, of course, China with WeChat. They were doing mobile a long time before we were. They were digital. And they say that 51% have a smartphone across Africa. By 2030, it will be 88% of the population. Therefore, that's a mechanism that we can use. How do you connect people more? Drones. So Zipline, a company in the US, is now literally from Rwanda, has blood storage and blood transfusions that get sent by a drone to where it's needed, using technology for the greater good, connecting people in a way that wasn't done before. The last thing, of course, is resources, like, for example, infrastructure, and, of course, the resources in terms of healthcare instruments and things. That can be changed. 3D printing could come in, for example, that allows people to produce instruments locally rather than being manufactured elsewhere. Infrastructure, let's think outside the box. Do we need hospitals? I gave a talk a few months ago to Institute of Architects. I said they'll be all out of job in the next few years, because actually you want mobile pods in the community for primary care, with remote monitoring facilities, AI interventions, doctors online, for example. Telemedicine, of course, has taken off since COVID. So if you look at the problems they're trying to solve, the technologies that underpin that are going to be the ones that we're going to be using much more and more frequently. And that's what I like to see it as, what those solutions that we create with those technologies available to us to allow more equity and more accessible healthcare.
So let me come back to the models in a minute. But both of you have raised the question of using existing technologies, deploying them at scale. But at the end of the day, if you wanted to scale something and democratize it, you need the technology. You need to understand the domain within which it's being deployed. But as a physician, I hate saying this, but at the end of the day, you need capital. And how are you going to drive that scale up, give it the fuel? And Jeffrey, you've been investing in a number of these areas. How do you make this attractive beyond, we heard about the cost of capital being so much higher in Africa, credit ratings, all of those things, and yet you're being successful. What's the learning?
Well, I think there are really pros and cons when you talk about the African market. You know, for sure that the healthcare spending is lower per capita. You know, GDP is lower on average. But then you look at the supply side. Really, there's substantial demand of all healthcare products. And then whoever that is willing to really go there and invest for the long term is going to really eventually, you know, harvest the result of their efforts. For instance, one of the largest mobile phone company from China is a company none of us have heard of. And they are by far the largest mobile player in Africa, and they're extremely profitable. So it's not in healthcare, but it can be applied, I think, in healthcare as well. You know, by 2030, the African pharmaceutical market will be $70 billion in size. So for people who are, and 70% of that market today is dependent on import. It means there's a huge opportunity to produce locally. And most countries in Africa would like to really have those products produced in their countries. And take vaccine as an example. And they rely completely on really the Western and Chinese vaccine during COVID. And vaccine is absolutely fundamental to address any infectious diseases. And I think whoever now is willing to take the time and make the investment and the efforts in Africa is going to do very well. And same thing with artificial intelligence and telemedicine. They're technologies that no longer require substantial capex. It's more really trying to make sure those technologies are well suited for the market. And in that sense, it's complex. It's not easy. But if you're really willing to make the efforts and spend the time, eventually you'll probably be the only one that is supplying the solution. That's the case in Africa, but that's not the case in the US, Europe, or in China. The competitions in most other regions is so much fierce than Africa. So I think it can be potentially a very, very attractive market for investors.
So, Yvette, you've done this not in healthcare, but water is vital, as I mentioned. You founded an organization, you've been running now for several years. What are the learnings from the water sector and related to that, the infrastructure that's needed for that, that we can now use and potentially leverage for accelerating this in healthcare?
Thank you so much. I think some of the models that I think will be great, models for the rest of the world, and particularly in healthcare, is to leverage community-based solutions. In our case at Iriba, when we supply water, we realized that we needed to have local people in those villages, in those communities, run our infrastructure to, promote that behavior change, to even increase the adoption rate. And it still applies even in healthcare. We see a lot of countries tapping into community health workers, where these approaches have really proven to be very successful. In the case of Rwanda, for example, community health workers really deliver basic healthcare solutions to the last mile. Very quickly, cost-effective, and very effective. And so I think those are the kind of models that I think will be greatly applicable in the healthcare system, to leverage on that local expertise and community-based kind of approaches.
So let me just follow on from there, right? We think of healthcare as three broad sectors: public health initiatives, primary care, the last mile, and tertiary care, secondary tertiary care. Three of us have practiced more in the tertiary care arena. And if we think about our own experience as practice, one of the things that I found remarkable right here in the Kingdom and in Riyadh is the virtual hospital. Currently seeing about 150 to 200 patients, patients per day. And reaching well over 100 hospitals, secondary sites, primary sites around the Kingdom. It intrigues me to ask the question then, at what point do you need, other than standard procedural specialties, we'll come back to robotics and all the rest of it, but I'm an endocrinologist. Much of what I do is taking a look at data and give an interpretation. A lot of clinical visits are the same. Do you have to set up the infrastructure, or is it time now to cross borders and regions? And and I'm not talking about Mayo Clinic or Columbia's really expensive infrastructure. I'm talking about reaching right into the rural communities. Your thoughts on that, Mehmet and Jeffrey? How do you invest behind that? How do you create those enterprises that actually are in the business of healthcare but aren't actually on the ground in the traditional sense?
Let me start and I'll hand it to Jeffrey because I want to actually comment on his observation as well. I think there's going to be a lot of technological leapfrogging. I remember when I was a child in Turkey, you had to pay money to get a phone number. You had to bribe someone to sell their number to you. So when cell phones came out, everyone wanted one because you could leapfrog the legacy systems that in the United States took years longer to get past. When you talk about a digital hospital, what you've been able to do here in Saudi Arabia was a leapfrogging over what probably couldn't have happened as quickly or easily in the United States. I think Africa could also lap Saudi Arabia if given the right tools. But I do want to bring up one big issue of operating expense versus capital expense. And Jeffrey, you mentioned this, but I look at this picture behind us of this child getting this vaccine. And last year when I was at the UN, I was in a session with the head of the CDC of Africa, and he said, it's better for us for national security to have our own vaccines made by us and other critical medications. But it is so much more expensive for us to do it ourselves that if someone else can help with the capital expense, we'll deal with the operating expense. So whether it's digital hospitals, primary care, as you mentioned, or tertiary care, it's going to be that same calculus that will either allow Africa to jump and show us wisdom that we otherwise couldn't learn, or they'll be held back by that. What do you think, Jeffrey?
Yeah, I agree 100%. I think it has to be done differently. You cannot just copy the models in the US or, even in some, emerging markets because they are going to be very expensive and they will take so long. It's hard to see how those investments will have real attractive returns. So with the technologies, now you can do them differently. Now you can really, have a lot of things that were not impossible in the past that can be done today. Yeah. I see one thing that is critical to the whole healthcare services sector is physician training. In Africa, and that's going to be a very big challenge. You need to have enough qualified physicians. Now with technology, you can train physicians much faster. And you have to really leverage technologies and then be able to build some of the infrastructures differently. What I will really think innovative solutions will be what people should focus on. They should not just look at what was done in the past and say, okay, let's try to do it in Africa. No, it's not going to happen. You should see, okay, there's so many new technologies that are available that are really making many things from the physician training to the telemedicine to the diagnostic to treatment that today are possible. We should really take advantage of those really development of new technologies and then come up with models that will be like the mobile phone to the fixed line, like in the communication. And same thing can be applied or can happen in the
Let me follow you
healthcare.
On that, though. The argument that we're hearing, and we heard earlier, was it's an attractive market, it's a large market, it can leapfrog, technologies are there. What's the barrier to moving forward at the pace that we need to in the continent? Why isn't it happening now?
That's a very good question, and certainly, and there is very complex market, and it requires people to really have patience to do this. And the example I use in mobile phone is a company that is very unique. And you have Apple, you have Samsung, you have all these companies. None of them went to Africa. This Chinese company went to Africa 15 years ago and basically has a monopoly of really the market today. And that's what it takes, visionary leaders of business who really see the opportunities rather than just saying, oh, there's so many challenges. And why I go there? I can go to, and it probably takes longer to build an attractive business to get returns, but eventually the investment will be so well rewarded, if you're willing to take kind of the long-term view with it. And that's what I think we need with a lot of investors and businesses.
I think if I rephrase what you just said, part of what you just said is maybe it's not going to be the traditional big multinationals that have a P&L, a balance sheet that doesn't lend itself. Their expectations from their shareholders may be very different. And so
it won't be good for that.
And it may well be different markets, different origins, and maybe new companies will get created that specialize, right? Yvette, you've been dealing with these challenges on the ground as an operator. If you were to project the next 5 years for healthcare, what are the things that you would want to see embraced as we move forward?
I think something that I would really look forward to would be solutions that address local issues in ways that involve Africans, local people themselves in designing them, in implementing them, and in sustaining them. Because I think there is really a huge gap when it comes to innovations that come in Africa. Very few actually involve the local people, the local organizations. And that's where a lot of challenges start to come in because there is really a need for local people who understand the local dynamics of how they can navigate policies, how they can navigate culture and stuff. And I think I'm really looking forward to see lots of these amazing technologies, amazing investments coming on the continent, but involving local Africans and local organizations to implement that.
So something, Professor Shafi, that my organization and I think about a lot is the world demographic change. There are 1 billion people over the age of 60 on the planet today. And some people in the audience may realize the world's population is actually starting to plateau now. So this projection that it's going to keep going up is actually not true, and we're seeing a plateauing. But what we're seeing much more dramatically, and you alluded to this, was the demographic change. That 1 billion people over 60 is going to become 2 billion. The continent with the most people over age 60, as you project over the next 30 to 50 years, is actually going to be Africa. Which creates an imperative. One, a large burden of older people. Second, a huge burden of age-related diseases because of susceptibility to cardiovascular disease, diabetes, cancers, all of those things. And you're a colorectal cancer specialist. That is dramatically increasing in parts of the world we never thought we would see colon cancer. Coupled by a deficit in human capital, which projected-wise, in our current healthcare model, is only going to widen. So, to Jeffrey's earlier point, we can't even on the delivery side do what has already been done in other markets. Not only on the financials, the capital, but actually our operating systems. Your thoughts on how you're thinking about this is what the future looks like if we were to now rethink this human capital deficit?
Yeah, it's a really good question. And I think it's also part of what you're doing with evolution, with longevity. I'll give you a couple of numbers to remember. So in the NHS, I'm from the UK, I'm London-based. The UK has a budget of £160 billion per year for the total NHS spend. Now, 90% of that budget is spent on secondary care, who do 10% of the work. Yet 90% of the work that does in primary care only are given 10% of the budget. It makes no sense. The work has to be moved to the community. It's about wellness, maintaining the chronic disease better, empowering people at home, personalized medicine, data-driven healthcare, all things that we've described in the last few years has to happen. There's no more new money in the world to support healthcare, despite the changes taking place. So you have to be more smarter. How do we create smarter, healthy living population? Longevity, evolution, chronic disease management, empowering people with telemedicine, remote care, monitoring, etc. That's the route we have to take. Otherwise, it's simply unaffordable. So we've got to rechange, reimagine, rethink, remodel our mindset to allow that patient care to be better delivered with the same resources as we go forward.
I know we could continue exploring this area in a number of ways. Any closing comments, remarks from any of our panelists?
I'm going to highlight something that gets overlooked. It's not altruistic to take care of these issues in Africa. The rest of the world learns a lot, which then allows us to keep up with the technological leapfrogging that we're already seeing starting to occur.
Thank you. Jeff?
Yeah, there's a lot of potential in Africa. And as an investor, we're very interested. We think, it requires patience, it requires a lot of effort, but when you're willing to do it, you get well rewarded.
Yvette?
I think there is a lot of opportunities, as much as, of course, when you look at challenges, for me as an entrepreneur, I look at that as business opportunities sitting there waiting for someone to tap into them. And there is massive innovators, entrepreneurs on the continent who are already doing something in this space. And so when you think about coming in Africa, think about tapping into those existing innovations, boost their capacity and make it work.
Thank you very much, ladies and gentlemen. Appreciate your attention.
Thank you.
Thank you.